And right now, we're continuing to work to find out more about the highly infectious disease measles. We understand you want to protect yourself and your children. Thanks so much for joining us on KHU 11 Plus. I'm Mia Gradney.
And I'm Marcelino Benito. The measles outbreak has had the largest presence in West Texas, with more than 120 cases being reported. And just today, the city of Lubbock has reported a patient hospitalized with the measles has died. This is the first confirmed death in an outbreak that began late last month.
And it is exactly why we have asked Dr. Catherine Troisi, an infectious disease epidemiologist at UT Health Houston, to join us. Dr. Troisi, thank you so much for being here. Let's dive right in. First question, have you heard anything about this death in Lubbock? If so, what can you tell us?
We know it wasn't a school-age child, and we know the child was unvaccinated. That's all we know so far.
So, Dr. Troisi, tell us, who is most at risk of measles? How exactly does the disease work? And what are some of the symptoms people should be looking out for?
So anybody who's not immune is at risk of getting infected. However, once, and that would basically mean unvaccinated. Once someone is infected, there are certain groups that are at higher risk of serious complications. That would be children under 5 and under, particularly those 1 and under, pregnant women, and then anyone who's immunocompromised because of cancer, organ transplant, etc. The symptoms are vary, but are fever, cough, red eyes, itchy eyes, and then the rash starts. You may also have a rash in your mouth that is very diagnostic of measles.
And just how contagious is it, and how does it spread?
It is one of, or maybe the most contagious virus we know. It spreads through the air. One of the things that makes it so contagious is that the virus can stick around. So if somebody with measles goes into a grocery store, say, coughs, sneezes, even speaking, you can, just like with COVID, you can, dispel the virus, expel the virus. Then that virus, so the person leaves, the measles infected person leaves, and someone else comes in, breathes that air, up to 2 hours later, they can get infected. So one person with measles can infect 15 to 18 other susceptible people. If you are susceptible, again, if you're vaccinated, you're protected. If you are not vaccinated and have never had measles, so you're susceptible, and you are exposed to a infected person, 90% of those people will get infected. So very, very infectious.
So are we seeing an increase in measles cases nationwide? We know we're seeing that here in Texas, but what are we seeing nationally?
So right now there are measles cases in 8 states. However, only 3 of those situations are considered outbreaks, and an outbreak means 3 or more people infected. So we are seeing many, many more cases here in Texas than in the rest of the country combined even.
And most people get the MMR vaccine when they're kids, 2 doses. But what can someone do if they're not sure about their vaccination status, their vaccination history?
Yeah, a couple of things you can do. You can check with your healthcare provider if you remember who your pediatrician was, or if you're a parent, check with the pediatrician. You can look at school records, because children are supposed to have had that second dose of MMR before they enter school. Now, we do have exemptions in Texas. But also, if you're really not sure, you can have your antibody levels tested with a blood test to tell whether you're immune or not.
And can adults get the vaccine? I know we're talking about these measles cases that we're seeing are in children, but can adults get the vaccinations if they're not vaccinated for some reason?
Yes, absolutely. And in fact, there's a category of adults where it is recommended that they at least talk to their healthcare provider about getting a booster dose. Booster doses are not universally recommended, But if you were born after 1957, and the reason that year is picked is because anyone born 1957 or earlier, it's just assumed you are immune because measles was so widespread, basically every child got it. So if you were born after 1957 and you received the measles vaccine before 1968, we had a different vaccine then. It didn't work very well. And so born after 1957, got the vaccine somewhere between when you were, well, 1963 is when it came out. So sometime between 1963 and 1968, again, talk to your healthcare provider about getting a booster.
So, doctor, correct me if I'm wrong here, but vaccinations for measles, mumps, and rubella don't start until a child is at least 12 months old. So, how can parents protect their babies until then? This question hits sort of close to home. My wife is expecting a baby in a few weeks, in April. So, what can parents in that situation do?
Yeah. So when babies are born, they have antibodies from their mother. This isn't just for measles. This is for whatever the mom has. Those antibodies go through the placenta and protect the baby for about 6 months. Now, it's not, it's 6 months and one day, all of a sudden they're not there. But in general, 6 months. So assuming the mother is vaccinated or had measles and therefore immune, the baby should be protected for 6 months. The problem comes that we really can't vaccinate or shouldn't vaccinate babies with the MMR before 9 months. Usually we do it at 12 months, you're correct, but in outbreak situations, you can do it at 9 months. It's at 6 months to 9 months where you want to be really careful about where you're taking your baby. If you have family, for example, in West Texas and you want to go visit, maybe that isn't the time to go. So, unless it's essential travel, avoid outbreak areas. Now, it's harder if you live in an outbreak area, and you just have to do the best you can to isolate the baby until they can be vaccinated.
So we're seeing a rise in vaccine hesitancy across the country. For parents who are hesitant about the MMR vaccine, what would you say to reassure them to get this?
Yeah, this is a very safe, it's been around since 1968, very safe, very effective vaccine. Now, I know that there is misinformation out there, including a fraudulent, unethical, retracted, disproved in many, many other studies paper that was published in 1999, Andrew Wakefield, showing a purported association between MMR and the measles vaccine in particular with autism. That is simply not true. And as we are seeing right now, measles is not a benign disease, and you can protect your child by vaccinating. And you're not just protecting your child. Not every child can be vaccinated. If your child has leukemia, for example, they can't be vaccinated. They depend on the community to protect them so that enough people around them, they're cocooned by immune people so the virus can't spread and infect this child with leukemia, for example. So again, talk to your healthcare provider, but there is a lot of data, information that this is a safe, effective vaccine.
I want to get to a viewer question, doctor. We have someone who asked, I am 61, was vaccinated as a child. I've since had to have my spleen removed for autoimmune disease. Am I in trouble?
I got to do some math in my head. 61, you were born after 57, and also after 69, right? Yeah, so you don't fall into that booster. I think the best thing to do is talk to your healthcare provider about your specific situation.
And that's really the thing. If you have any concerns, be in touch with your physician to help guide you through those concerns in the process. Another viewer question that we had, this is from Erlinda Sanchez Cruz. She wants to know, are there separate vaccines for MMR?
MMR is one vaccine. It contains measles, mumps, and rubella, also known as German measles. So it's one shot and protects you against these three viruses.
So, doctor, we have another question coming in from a 61-year-old female. She says she has type 1 diabetes. She's had it for 51 years, plus other illnesses. Vaccinated in the 1960s. She wants to know, is she safe, or does she need to take precautions with masks or other precautions? Or what about an update to vaccination for her as well?
Yeah, again, check with your healthcare provider. You may fall into that vaccinated between 63 and 68 with the killed vaccine, which just unfortunately didn't work that well. Again, everybody's case is different. Your doctor or healthcare provider knows your particular situation, so definitely check with them.
I think she asked something that's interesting and want to get your take, doctor. She asked, should I be wearing a mask or taking other precautions? Let's review the precautions that you can take to avoid getting the measles. Will a mask work in this case? What should we be doing?
I don't know of any studies that show whether a mask works or not. I would guess that it provides some protection. But like COVID, the measles virus can be spread on surfaces. So it's not going to be complete protection. Now, I will say that we have very high flu rates right now, so wearing a mask might not be a bad idea anyways. But we do have a way to protect yourself from measles, and that's the vaccine. We didn't have that with COVID in the beginning.
We do have another viewer question. They're sort of the same sort of topic. So if you could reiterate, because people are probably tuning in, and the timeline that you laid out about when 1957, you also mentioned 1963 when the new vaccine, I believe, came out. So this woman named Denise is asking or saying that she received the measles vaccine 30 years ago. She wants to know if she has a booster shot. So if you could just sort of give us that timeline again that you laid out as to when the new vaccine came in and how that impacts people who may have got it before then.
Sure. So 30 years ago, you're fine. You got the updated vaccine. People born 1957 or earlier are presumed to be immune because the virus is so infectious, basically every child got it. If you were born 1957 or really after 1957, so 1958, and were vaccinated, the first vaccine came out in 1963. So if you were vaccinated between 1963 and 1968, when the updated vaccine came out, then you may need a booster. But if you were vaccinated 30 years ago, that was 1995, right? You should be fine.
I know we talked about earlier, you had mentioned a patient with leukemia, but want to ask the question, are there certain populations like the immunocompromised individuals who can't get vaccinated, and how can they stay protected?
Yeah, and leukemia is an example of immunocompromise, but there are organ transplants, other immune diseases, and also pregnant women can't get vaccinated. If you are planning on getting pregnant, make sure you are protected beforehand. So the way we protect those people who can't be vaccinated is through community immunity. And because this virus is so infectious, 95% of people in the community have to be immune. And I'm just going to say vaccinated. I'm going to assume they didn't get it, as a child. But immune to keep the virus from spreading. Now, I will say that we have seen declines in immunization rates, not just in the United States, but worldwide. We particularly saw it during the pandemic, but it was happening beforehand. Right now, the country as a whole for MMR is at 91.6. That's not 95%. In Texas, we're at 89.9. Again, not 95%. However, it doesn't matter what the state of Texas is. What matters is what your community is, who you see every day. And there are schools that have much lower immunization rates. We make it very easy in Texas to opt out of immunizations just for personal beliefs. There are over 20 bills in the Texas legislature right now that would make it even easier to opt out. So when even if Texas had a 95% If Houston, let's say, had 95%, which it does not, but if it did, it wouldn't matter if the school that your child goes to has a lower rate. And 94.9, probably okay. I'm talking 80, 60%, much lower rates of MMR vaccination.
So, Dr. Troisi, if you happen to get the measles, should you go ahead and get the vaccine? Will it do anything at that point?
If you know when you were exposed, which most people probably are not, but if you know you were exposed, you can get the vaccine up to 72 hours afterwards, and it will still work. The incubation period is relatively long. It's between 7 and 21 days, a week to 3 weeks, with an average of 2 weeks. So the virus isn't overwhelming your immune system right away. If you are at high risk and you know you're exposed, you can also get immunoglobulin up to 7 days after exposure. What I can't say it, immunoglobulin is you take plasma from people who have been immunized or again had measles. They have antibodies in their plasma, part of their blood. You isolate the antibodies and you can inject that into people to protect them for about 6 months. It's the same way that passive transfer of antibodies from pregnant mothers to their babies happens. So it doesn't last forever. It's not like being immunized, but it can get you past like a baby past when they've been exposed to when they can be vaccinated.
Dr. Troisi, I want to address, there's so much information that's circulating out there online right now. We've seen everything from people talking about throwing measles parties to growing up, all of my siblings had it. We just stayed home for a few days and we were fine. It made our body stronger. Let's address some of this information that is starting to pop up online, starting with the scary idea of these so-called measles parties.
Yeah, not a good idea. Now, it is true, when I was a child, I'm old, I don't think my mother had measles parties, but certainly there were measles parties, but there was no other way. Every child was going to get measles. The point of measles parties was to sort of time when your child was going to be sick. But as we saw today, there can be very serious consequences up to death. And why you would want to expose your child to a virus that is vaccine preventable, I don't understand.
So, Doctor, this death in Lubbock could result in a lot more people looking to get vaccinations, but the speed in which a vaccine takes effect with immunity could be an issue. So, at what point after receiving a shot does the vaccine actually become effective? How long does it take?
Yeah, for most vaccines or really exposures, it takes your immune system the first time it sees, we call them antigens, the thing it's making antibodies to, takes about 2 weeks. Now, to get full, I don't want to say protection because you're not fully protected after one shot, but to get the maximum amount of antibodies you're going to get, 2 weeks. So, but you're building that up during the 2 weeks. So it's definitely worth getting it. It just may not provide complete protection, but it may make you have a milder case, like we saw with COVID, like we see with flu, like we see with most vaccines.
Doctor, what is the concern within the medical community? Speak to the gravity of this and this outbreak and watching the numbers rise on a daily basis.
The concern is, the numbers rising on a daily basis, that this is not a benign disease, that we are going to see children with encephalitis, children with pneumonia. 1 out of 20 children get pneumonia. Last year, 40% of the measles cases were hospitalized. It's a serious disease. The other concern is that many doctors, young doctors, or maybe even middle-aged doctors, have not seen a case of measles and may not be diagnosing it right away. So it's really important for healthcare providers to be educated on what to look for. a lot of things can cause rashes, can cause coughs, runny nose, itchy eyes. Um, and so to think measles.
You know, it's interesting you brought up that there might be younger doctors who don't exactly recognize the measles at first, but I think that's kind of the scary part is so many of those early presenting symptoms, right, mimic so many other viruses that are out there right now and commonplace.
Yeah, exactly. You know, it could be spring allergies. It's not going to tell you it's measles until you get the rash, unless you know for sure you've been exposed. You know, a sibling has it, and then another sibling gets these symptoms. You might be pretty sure that's what it is, but in most cases, you're not going to know. You're right. And so it's important to watch your children. If they have these symptoms, contact your healthcare provider. There are tests that can be done even before the rash occurs. Um, and you know, I should mention also that one of the tools we have is contact tracing, just like we did during COVID. And viewers may have seen the recent report that someone incubating measles from West Texas traveled to San Marcos and San Antonio and Bucky's in Comal County. And potentially many people were exposed because there are a lot of people in these places. And as I mentioned, that the virus can stick around for 2 hours. Sorry. So you could be visiting a Bucky's. You don't know that 2 hours before someone incubating measles, not that you would know that anyways, was in there. And it also points out that you can be infectious before you show any symptoms, just like COVID.
So doctor, we got another viewer question where they're asking what treatment looks like for someone who has the measles. So we know several people are hospitalized out in West Texas. What does treatment look like in a hospital setting right now?
Yeah, we do not have any antivirals. It's really supportive care. So if you have encephalitis, trying to get that brain swelling down, pneumonia, you know, oxygen, that kind of thing. But we do not have specific treatments for measles.
So it's basically just waiting out the measles once you get it and being cared for, tended to.
Mm-hmm.
All right. Are hospitals in Texas, are they prepared for a possible increase, dare I say, explosion in measles cases?
Well, as I mentioned earlier, we're having a bad flu season, which means that hospital beds are tend to be filled. It just depends on how bad it gets. And of course, if you have a measles patient, you don't want to put them in just a hospital room. You do not want to infect hospital staff, other patients who may be susceptible. So you need special quarantine facilities. So it's just going to depend how many cases we see and how many need to be hospitalized. As I mentioned, last year it was 4 out of 10 had to be hospitalized. Usually we say 2 out of 10, but last year saw more.
So doctor, going off that, if someone suspects they do have measles, what do you recommend they do? Should they go to the ER, or is there some specific type of protocol they should follow to prevent the further spread you just talked about?
Yeah, they need to call their healthcare provider, because you don't want to just make an appointment and sit in the waiting room with all these other patients, some of whom may be immunocompromised. So healthcare providers should have protocols set up for potentially measles infected patients.
We're getting into more viewer questions right now. We know measles are in West Texas. Someone writes, should we be worried about it here in Houston?
Well, I don't have a crystal ball. However, as I mentioned, we already have had exposures in San Marcos and San Antonio, which are a whole lot closer to Houston than West Texas. There's travel between the two, San Marcos and San Antonio and Houston, and I would not be surprised at all to see that we have cases in Houston. Houston's immunization rate is at 86.2. That's almost 10% lower than we need to stop community transmission. Um, so it is possible that we will see an outbreak here in Houston as well.
Would there be a difference here in Houston, though? Obviously, we're way more populated than out in West Texas in these areas that we're seeing them. So could we see a faster, more rapid spread if we did have an outbreak here in the Houston area?
Yeah, we certainly could because our schools are more, have more population. And then if you want to flash back to 5 years ago, the rodeo's coming up, and public health officials are very concerned about that. That's a great way to spread measles, should we see it by then. And people come from all around for the rodeo.
So what steps do you think public health officials should be taking right now?
Alerting people to the risk, providing and promoting vaccine, because that's really the only way to protect yourself. And then doing education with healthcare providers about what measles looks like. Health departments are doing contact tracing. But again, this case from West Texas that, let's just say, went into the Buc-ee's, never mind all the other places he or she went. How would you possibly track all the people who may have been exposed in that Buc-ee's over a 2-hour period? So contact tracing is very difficult.
Hence your concerns with the rodeo. We're talking about a gas station road stop compared to one of the largest events in the southern United States, I would say.
And that's what we saw 5 years ago, to your point, Doctor, with the COVID pandemic.
Yeah.
We saw it really explode, as you remember, Mia, after the cook-off, actually. Finally, Doctor, is there anything else that you think we need to know about the measles and this outbreak that's going on in West Texas?
Yeah, again, the way to stop this outbreak is to make sure everyone is protected, and that's through vaccination. This child's death is a tragedy. My heart breaks. As a grandparent, I can't imagine. Luckily, my grandchildren are vaccinated and protected, but the vaccine is safe, it's effective, it's free. If you don't have insurance, that is not a concern. There are vaccine clinics around Houston, in other cities as well. So protect your children.
Fantastic advice. Dr. Troisi, thank you so very much for joining us, educating us on measles prevention at this point, safeguards, the signs and symptoms to look out for. We appreciate you, and thank you so much. And thank all of you for joining us on KHU 11+.
We've got more information about measles on our website, available to you anytime on khou.com.